Welcome to the Community Pharmacy New Revenue Roundtable. My name is Breck Rice. I'll be your host. I'm the co-founder of ServeRx, and glad that you could be here today. Got some wonderful things to share with you, but let's first, talk about what the problem is and what is affecting negatively our community pharmacy partners right now, and that's margins, DIR fees, the PBMs, their clawbacks, and their poor reimbursements. Back when I started, in 2003, so over 20 years ago, profit margins were fair. They're about 36%, and today, now they're only around 3 to 5%. So if you're really counting on dispensing revenue as being your total revenue solution, you're going to have problems like these poor pharmacies have had, where they just were focused on dispensing revenue, and the low margins and the DIR fees have unfortunately put these wonderful community pharmacies out of business. Some that have been around 80 years, 106 years. I get updates from all of our PSAO and buying groups, and here's the latest list, just a few of some of the closures that we have been updated to. And part of that reason isn't just the poor margins, but it's also the DIR fees. So this is a really telling slide here, because if you put things in perspective, the increase from 2010 to 2019, those DIR fees increased over 91,000%. So that would be the equivalent of a gallon of milk costing, over $3,600 for just 1 gallon of milk. So it's absolutely ridiculous. And if you're focusing 100% or 90%, like a lot of our independents are in dispensing, it doesn't matter how many more patients you get, you're just not going to be able to survive at that 3 to 5% profit margin. So we highly recommend that you try to get about a third of your revenue coming into your pharmacy that is non-dispensing revenue. So we have some great ideas and some great solutions for you today that we want to share. And one of my favorite all-time hockey players, Wayne Gretzky, talked about why he was such a good player was that he skated to where the puck is going to be, not where it has been. And that's really what we need to do as community pharmacies, is really move to where the puck is going, and we can't stay in the status quo. I always talk about, that the status quo is one of the biggest risks for community pharmacies today. And Will Shaw from my team, if you'll take just 2 minutes, Will, and share with us the ServeRx program that's absolutely free to every community pharmacy.
Absolutely. Great morning, great afternoon, everybody, depending on where you're at. Like Breck said, ServeRx, we love community pharmacies, and here's another option for you to bring some capital in. We have no affiliations with the PBMs, so we're out of network. As you see right here, for example, it is a free service for the pharmacy. As you see right here, for example, meloxicam. If a patient walks into your pharmacy and they need a meloxicam, if you was to process that meloxicam through a PBM, your pharmacy may be reimbursed $4 to $5 for that meloxicam. So nowadays, I'm even seeing pharmacies being reimbursed $101 to $103 when adjudicating those meloxicams through ServeRx's bin and PCN. And your pharmacy will be reimbursed in 30 days through your central pay. Or if you're an independent pharmacy, your pharmacy will be reimbursed 45 days directly from ServeRx. Okay. Again, we do all the legwork for the pharmacy, so you never have to worry about contacting an adjuster or the insurance company. If it ever escalates to that, our team will verify the claim. We also have a help desk that's available 7 days a week for the pharmacy. If you was to receive a rejection, feel free to give our help desk a call, and they can help the pharmacy receive that paid label for that workers' comp claim. Again, this is a free service for the pharmacy, no enrollment fees, no annual fees, no hidden fees at all. We're just here to help pharmacies keep those fair reimbursements that the pharmacy legally deserve.
Awesome. Thanks, you Will. Thank you, Will. Appreciate that. And please put your contact information up in the chat. If you have any additional questions for Will or I, please go into the chat and you can ask those questions to Will there. So let's wanted to move on. We know most people are familiar with this program, but wanted to move on to my RxSpark because John does have another commitment that he needs to get off to, but we want to turn some time over to John to cover this program. If any of you saw the communication I sent out about this roundtable, I mentioned about opportunities for your pharmacy to generate revenue while you're sleeping. And this is one of those opportunities. Absolutely fantastic opportunity for your pharmacy to actually be making revenue for you, even when you're away on vacation or sleeping. John, tell us more about your program.
Thank you. Thanks for the invite. So our background is we built WebMD and we built Yahoo Money, and we went into looking at a pharmacy discount program with PBMs. And we sort of cutting out all the costs associated with that from the PBM and what they charge of $7. We've reduced that to being a very competitive pricing model for a pharmacy discount program. Cheaper than GoodRx 85 out of 100 times. So we've moved that and looked at the community pharmacy by talking to Breck and some of the problems that you're facing. Think of this as layers. The first layer is we've created a program called My RxSpark for the community pharmacy. Every community pharmacy has their own member ID, so we know exactly which community pharmacy is pharmacy users and prescription users are using. As a layer, you get your fill price for the agreement with Capital of exactly how much you want to put the pills in a jar. I make money from the PBM, and I share that money with you every time your users put a prescription through your pharmacy. So it's an increase in making more money at the dispensing level. The second level is that they may not just use your pharmacy for all their drugs. They may be going to CVS or Walgreens for some things. They may be out of town visiting people. By using your card, you still get that increase in the adjudication fee. The layer says they can tell all their friends and family about the savings of My RxSpark, 90% discount at 62,000 pharmacies. It doesn't matter where they are in the country. Again, it's adjudicated by the PBM. We know which member ID it is, and we know which pharmacy. So when the users are using the pharmacy outside your area and or their family and friends, you can earn from that. So this is what the program does. It's really, really straightforward. We're improving it as we learn more about the community pharmacy. So when you go to the site and go to registration, the user can put in the pharmacy of their choice, which is one they choose. But now we've realized that by putting a member ID in specifically to each pharmacy, then we know exactly which community pharmacy. So there's no way there's any gray areas. So again, this is a learning program for us as we improve the service. We're creating a portal site now that pharmacies can join and get the brochures and their cards and the QR codes and distribute it in the community as their branded card outside. So more and more is coming as we listen to community pharmacies.
Awesome, thank you. And I am spamming the chat right now with the link that you can go to. This is a great overview of the program, a little explainer video. So on deck now, and actually let's see if there's any questions first. So let me go back to the group here. Are there any questions first for John before we let him go? So any questions, go ahead and speak up, or you can use the reaction button and raise your hand. My home health test, Alec or Brett, if you're here, go ahead and speak up. But this is the other program that generates revenue for you while you sleep. Each pharmacy is assigned a unique QR code, that that is specific to your pharmacy. Anytime a test is ordered, your pharmacy gets credit for that home health test. This is to deal with a public health issue with STDs or STIs, a very discreet way for patients to get this test sent to their home discreetly. Like I said, they could get tested, send it off, sample off to the lab, and then if they have are in need of an antibiotic, then that is then sent to your pharmacy because you're the pharmacy of record. So a really wonderful program. You get paid for the test whether the patient picks it up at your pharmacy, or if My Home Health Test, the fulfillment company, actually ships it to the patient. Either way, you get that that revenue for the test. So it's between like $10 and $15 per test. So I think this is mailbox money for our community pharmacies. Everyone needs to get enrolled in this. The program was supposed to have launched, but the first shipment, the packaging, the boxes weren't what the samples were, and so the whole pallet was sent back to be redone so that it's a very high quality, nice solution. And they're not resourcing anything out of China, so that's the other reason they want to do it right and do all of the resourcing here in the United States. Is there any quick questions about that program? If not, then let's move into Germs RX with Scott Lampier. Scott?
We've all dealt with this for the last 3 years, and that is the dreaded beginning of our days is with the alcohol-based hand sanitizer. And so what we've done is we've worked with the manufacturer to develop a whole line of alcohol-free products and harsh chemicals. And with the new nanotechnology, we kill germs physically, not chemically anymore. And so it's a flexible, covalent bonded compound that is you can't know it's there. There's no fragrance, there's no smell, and it's 98% water, and the performance is just tremendous compared to alcohol-based, because when the alcohol dries, which is the active ingredient, it stops working. So give or take 30 seconds. Our products, as a minimum, work 4 hours, and it doesn't wash off with soap and water. And Breck is always my best advertisement for his family. He uses all our products. My website will be up fairly shortly, and you can purchase on there. It'll be e-commerce, but everything from antimicrobial to wipes to wound care. It's all FDA approved or EPA registered, and I have fun every day. Right now I'm dealing with somebody that Breck just talked to on the East Coast, and her daughter had a severe immune reaction to the COVID-19 vaccine, and literally we're saving her life because she is so germ
immune compromised.
She's septic right now in the hospital because she scratched herself when she was going to physical therapy. And so that's the type of thing that we can guard against, and it's just so rewarding to help people like that with our products.
Yeah, amazing products. Last if the FDA says it lasts for 4 hours, then it probably lasts a lot longer than that. But a great product does require a little bit of education to the patient, and so that's why we present it here on the roundtable, so that our pharmacy partners know about this amazing product. And the profit margins are great for the pharmacies, high 40s to 50% profit margins. So are there any questions for Scott at this time on that? Feel free again to ask any questions in the chat, or you can also use the reaction tab and raise your hand so that we can get your questions answered for you now. But up next, I want to invite Jonathan to talk about this exciting new product, BreathRox.
Thanks, Brett, for having me. Yes, I'd love to tell you about Breath Rocks. What Breath Rocks are, they are popping breath mints. So if you can imagine, they're basically sugar-free pop rocks with zinc, and they're absolutely fantastic. What we found is when we launched at NCPA a few weeks ago, pharmacists and their staff are just having a tremendous reaction to the product, because basically it works in three ways. First, when you put this product in your mouth and that popping's going on, the zinc is actually neutralizing the gases in our mouth that cause bad breath. So that's the first way it's working. The second thing is when all that popping is happening in your mouth, it's actually helping to activate your saliva glands. And then the third thing is with all those small little, breath rocks, pop rocks types of pieces, as you're rubbing them around in your mouth, it's actually kind of scrubbing your teeth and your gums. So it works in three ways to really create, a fantastic breath mint. So other breath mints out there like Tic Tacs and whatever, those basically just, perfume, it's just candy. This is actually a functional product. And when we found with the pharmacies, not only did they recognize this is maybe the best breath mint ever, but it's actually a fantastic tool that they can use to be able to help in their doctor detailing, different ways they're building relationships with their community, things like that. So this little breath mint is a great door opener to be able to bring traffic into your pharmacy and to build relationships with folks. And so this product, we are literally shipping it this month. So if you're interested, please, my email is in the chat. Send me an email. We'll send over an RSVP and we'll get this product shipped out to you this month. The wholesale price for pharmacies is $1.74 and the retail price is $3.49. So it gives you that 100% markup, 50%, keystone margin. And this product, although it's brand new, it's actually been on the market for several years, but it was sold on, QVC and HSN, Facebook in a big $30 box with 90 of these little, tubes. We came in and rebranded it and are launching it through independent pharmacies. And the last thing that I'll mention is that one of the keys that we have done here is all of our funding has come from independent pharmacists, C-store owners, medical supply folks, because this is a product just like pharmacies are around for decades, multi-generational families, pharmacists. This is actually a product that we are designing for pharmacies to be able to have for a very long time, to be able to sell not just as a breath mint, but actually as a tool. So we've actually at this point have raised over $200,000 in our seed loan. That's what helped us get this first 100,000 bottles. We're now getting production going on our 300,000 bottles. So if you're interested in that, please again follow up with me. But meanwhile, we're launching a crowdfunding campaign next month, and then that way we'll be able to have tens of thousands of consumers who are excited about this that say, "Hey, man, I love breath mints." From Breath Rocks, I'm going to put $100 in. I'm going to put $500 in, and that'll help kind of spread the word. So it's just an exciting product. It's something that is really an interesting way to build relationships, and frankly, it's just something that it's just fun to try. It's fun to talk about, and it's fun to share. So if you have any questions about that, please let me know. We'd love to be able to put in your pharmacy. And I'll tell you one quick story. One of our investors, Jeff Gross, down in Los Angeles, he actually took 3 boxes, put them on his pharmacy shelves. They sold out in a week. His staff didn't even know what the product was. They just were sitting on the checkout counter. People saw this great little black bottle that looked really interesting. They read it, thought, wow, popping breath mint sounds great. And they sold out in a week, just like that. So I think we're going to have a really fun, kind of a rocket ship product here. We'd love to be able to put in your hands.
It's awesome. Thanks, Jonathan. And it tastes amazing. Jonathan's contact information is up in the chat. Are there any quick questions for Jonathan? I can tell you too, I'm a strong advocate for outreach, for physician outreach. When pharmacies will go out to the doctors in their area and detail them, they absolutely pick up more patients. We see on our side in workers' comp, we see about a 14-15% increase in scripts in claim count when you go out and detail. So stop taking them, donuts and stuff from Krispy Kremes or whatever. Take them something from your pharmacy. I love that analogy that Jonathan gives all the time. So, Jessica, are you here from Real Value today? You didn't see you come in, but Real Value is a wonderful partner that is a secondary wholesaler. Of course, I think most of you are familiar with them. We love them because they also have profit solutions. So the product portfolio program, they'll actually provide you with marketing materials to go out, and they're all indices that have great reimbursements for our community pharmacies. And so you can take those product portfolios out when you're detailing to the physicians. So if you need help getting in contact with them for more information, please just reach out to me. I'm happy to get you connected. Now, I wanted to give a little more time to the next speaker, because this is a brand new service that is just coming online, and it's amazing. I do a lot of outreach. I do a lot of social media contact, and I'm paying for 5 or 6 different platforms to do everything that I do in digital marketing today. And PharmacyHub, this is amazing. They're bringing that all into one platform, so just one subscription instead of 5 subscriptions for doing all these services. So I wanted to turn some time over to Devang to tell us more about his program. And you wanted to share your screen, right?
Yeah, Brack, if that's okay. And can you hear me okay?
Sharing and give you the power here.
Okay. And you can hear
go
me
ahead.
okay, Brack? You can hear me fine? Yeah?
Yes.
Okay. Got it. All right. So what I'm gonna do is I'm just gonna share my desktop, if that's okay. So I can flip between different screens. So yes, thank you, Brack, for teeing it up. As you've talked about, Brack, the pressures independent pharmacies face, right? And we all understand that, from PBMs, lower reimbursement, DIR fee, rising labor cost, what have you. So there's pressures from all different angles. And to add to it, now you have competition also from new fancy mail order or modern pharmacies like Amazon Pharmacy, Mark Cuban Pharmacy, or what have you. Again, there's nothing unique or new about them. They've been around for a while, but they have fancy fronts, digital fronts, websites and all, and customer service, which again is extremely important. And we as independent pharmacies have sort of lagged behind and on that front a little bit. And the technology that's available to independent pharmacies hasn't evolved. So what we've come up with a platform that Brack has talked about. And what it does, it allows you to attract new patients. So you need that modern digital website. That is your front door. When people look you up, that's where they land. They want to interact with you, so on and so forth. And studies show modern websites with engaging content can increase your traffic as much as 38%. You also want to retain your current patients that you have in addition to attracting patients. That's engaging blogs, social media outreach, email marketing, and not just for patients, but for doctors also, to keep them engaged. And then finally, you want to reduce your expense, because we know in pharmacy, $1,000 saved a month is $10,000 or more earned in revenue, just because of the low margins that we have in prescription. So, we understand, again, independent pharmacy owners understand that there's a need to do a lot of this, and you go the extra mile. You do a website that you have currently. Maybe you pay an agency, or you have a platform that you're currently using, but that costs money. And to make even simplest of changes, like adding a picture or adding a message, it takes days, and there might be some restrictions there. For blogs, you do that, but again, either they're boilerplate blogs provided by this tech platform that you may use, or you're paying somebody for writing that content. Again, dollars adds up. Email marketing, those platforms are expensive. If you don't do it, you'll have to pay money. And then posting to social media, if you have LinkedIn, Instagram, Google page, Facebook, which a lot of pharmacies do, you're spending time on posting to 3 or 4 different social media channels, tracking how people are reacting to it, and so on and so forth. And then you pay extra for appointment scheduling, which a lot of us do or need to have for vaccines, appointment, and so on and so forth. And this is just a short list. I mean, there's a lot more that we're sort of, it's a patchwork. We're paying for different features and functionalities. So we have built this purpose-built for independent pharmacies only. That's who we work with. That's who we will work with, for many years from now. Also, purpose-built for independent pharmacies, all in one. So you can have, with very minimal training or learning curve, you can do all of this from sort of your control tower and reduce your expense. You don't have to go to 10 different websites, just in one place, do all this and reduce your expense significantly. I'm talking maybe a quarter of what you pay when you combine all the services you're paying for. So as I mentioned, website builder, artificial intelligence, enabled blog writer, appointments, patient chat, social sharing, etc. And then we also have a lot more stuff coming online within the next 3 to 6 months, and all for one low price. We're not we won't nickel and dime you. It's just all there, again, that you can access from one dashboard. So with that, let me switch to this dashboard real quick. I won't spend time on all of these. Obviously, that's for a different day. But you'll get access to something like this. This is your dashboard. You can see how many web pages you have. And by the way, there are no charges for additional. I know some of the services you use today, they tell you 10 pages only and then charge for every incremental page. None of that. Unlimited pages. Also, the current platforms don't really give you a translation option. We understand independent pharmacies have pockets of Spanish-speaking people or Korean, Chinese, what have you. So free translations as well for all these pages. So it shows you the websites or web pages that you have. The site shows you blogs. You can have the blogs provided by the platform, but you can write your own blogs, which a lot of you like because there are issues specific to your community that you want to highlight, that you want to talk about. So and then you've got all these features on the left that I talked about: digital marketing, conversations, appointments, what have you. And I'll go into some of these, but just starting with your website real quick. I've created a few pages. I'm just going to go edit. You can start with a blank canvas, and I can do that here as well. I'm just going to delete all this. And I'd say, you know what, I definitely need a header, which is there. And then I need what's called a hero section, right? Either I want something like this, and you can change images, text, everything, or I want something abstract and modern like this. So you can do anything. You just drag and drop, and you change it to your pharmacy, Joe's Pharmacy, and you can customize basically the colors, the images, every little thing on this. Again, I'm not going to go into, we don't have time to go into every feature. And then you add services, what services you offer. I can move this up or down. So I'm just going to go move this up and down. So I move the services down here. I'm going to add FAQs. A lot of people have FAQs about where are you located? How do I transfer prescription and this and that. Testimonials, nothing says you're a great pharmacy better than real testimonials, and so forth, so on and so forth. And you can add calls to action, refill now or transfer now, stuff like that. So there's a lot of elements that you can play with. And once you do that, I'm trying to move this Zoom panel. Once you do that, you just publish it and you preview it. And here's your Joe Pharmacy that I just created. As simple as that. You can change it as much as you want. There are times when, there's Veterans Day, 4th of July, or COVID vaccines were available just recently, or flu vaccines. You can put all those banner messages there. You don't need an IT person. You don't need to email somebody, etc. Can you email us? Absolutely. We're here for you. But it gives you the freedom to do what you want to do. And then going back to, I'm going to close out this page. Going back to what we had here, you go back to the dashboard. This was just an example. Blog, I create a new blog. Again, you can have standard blogs, but I'm going to call it Diabetes 2. and will help you with these titles and descriptions so your blog rank higher on Google. But you can start writing and use select causes and treatments for diabetes, and you can start writing diabetes is a leading cause of, and then you let AI just write this for you, and you go in the US, and again, kind of let AI expand, just build upon what you're thinking. Causes include, and you go types of diabetes or AI writing pause continue. Yep. And so in just last 15 seconds, I wrote a decent blog. Obviously, you'll read it as a pharmacist, you'll tweak it, you'll make it your own, but it gives you a great starting point. And again, you publish and you preview it, and you've got your blog. And all of this becomes available on your website that I showed you can create. So extremely simple. We want to give you the latest and greatest technology, AI, everybody's talking about. You should have access to that as well. And so that's pages, blogs, and then you can go appointments, not paying another $39, $49, $100, whatever folks charge for appointment scheduling. You get your own appointment scheduling platform. You can come here, you can manage appointment types. You can create as many as you like, flu, COVID, RSV, or just one for all vaccinations. You can add as many questions as you need in those appointment templates, so that they can include their insurance information, this, that, and the other. And this all goes back to your website also. The links get embedded in your website. And then I'll show you quickly conversations. This is neat. So if I go to one of the websites that we'd created, homepage, and I preview it, you see this talk to us button. You get a chat, which is also AI enabled. So artificial intelligence will be able to answer most of the questions about your pharmacy, meaning where is it located? How do I transfer prescriptions and this and that? But for something else, they need to reach out to you, which is important. You don't want to lose a customer or a patient that's found your website now and wants to engage with you. And so you say, hi, I had a question about RX transfer, and you go boom. And if I go to my this website, this admin portal as a pharmacy owner or PIC, whoever it is, I get this message. I had a question, and you can respond to this. Sure, how can we help? And they receive that message right away. And what it does is they don't have to be on, this is not a live chat. It can be, but it doesn't have to be. They can close out this browser, go do whatever they need to do, they meaning the patient. When you respond to them, they'll get an email that there's a response, and with a link, they can click that link, it'll bring them back to this chat. So it becomes an asynchronous chat. So that you get that with all the, the website and whatnot. And then we've got online stores. So if you wanted to sell something, you could enable this online store with a click of a button. We've got shipping, low-cost shipping. So you go to stamps.com or ShipStation or what have you. You don't need to do that. You can use the same platform, print labels, have tracking numbers, track the status. They update every 10 minutes. So you know when something was delivered, all in this platform. And our USPS rates are about 10 to 30% cheaper than ShipStation and whatnot you use. And then I think one last thing I want to show is social media. Breck talked about it. Again, every pharmacy that I've come across, or most of them, have a Facebook page. A lot of you have Google pages as well, and LinkedIn and so on and so forth. You shouldn't have to go to 10 different places to make those updates. You just, again, use this platform. You want to compose something. So you'll come here, you'll add your profiles one time only, and then After that, you compose something, and you see Google, because I've just added Google here. If you had LinkedIn and whatnot, they'll all show up as tabs here. And you say fall is here, and you attach images. And you don't need to have your images. You can upload your files, but you can just simply go to one of these sources and just search for fall season. You get these images. I'm gonna pick this. You get this, boom. You type your message, whatever you want to type, and then this is your original. So if you want to go here and edit the image because you think it may or may not fit Google messaging or Facebook or what have you, we give you Google My Business by default. So you just click this and it changes the image size, so you can make sure it's accepted, it posts to Google, and you just click OK. And same thing for all the other platforms that I showed you: LinkedIn, Instagram, Twitter, etc. And you click send now, or if staff is doing it, PIC is doing it, owner wants to approve it, you can hit send for approval, and owner can approve it. As simple as that. So again, a lot of this is available to chains and big corporations, and I come from McKesson. I worked there many years, so a lot of this stuff is available to large organizations, big box stores. We're passionate about giving this technology to independent pharmacies and make sure you all have access to it in a very easy to use manner, and for a low price that pays for itself very, very, very quickly, and you reduce your expenses along the way because you're not having to use 10 different platforms. So if this is something you like, and again, we're working with different organizations and talking to NCP and others as well. But meanwhile, if this is something you like, you're interested in, first 100 customers or pharmacies we onboard get a steep discount. So I don't know if Breck has added the URL in the chat, but if not, we can, and you can go there. Yeah, I see they're added. You can go there and
spam in the chat right now. I'm spamming.
Awesome. Click sign up and get set up very quickly. It's not months, it's not weeks, it's not even days. It's like 1 or 2 days and you're up and running.
Awesome. Questions for Devang? Anyone have any questions? Great platform. Looking forward to using it myself, and excited to bring that on board as well. So again, all these platforms all in one place, and then more stuff is being added all the time, so that I didn't even know about the things in play, like payroll and other things. And I did notice, Devang, also that one of your blog topics was for hair loss. Was that because you're dealing with me now, or?
I didn't want to call it out, Breck, but certainly gave me an idea to write a blog on that.
That's awesome. That's awesome.
It's some of the easy topics that I can quickly write blogs on.
Yep.
So.
Well, and how cool that is that you just kind of start typing and then have AI fill in some of the things, even when because you always have your own way of putting something, but somehow you need that creative juices to get started. And so AI can give you that template, and then you can go in and then it brings all the things to your memory, what you wanted to say, and you can go in and make those changes or additions. But how quick that was for you to write.
Yeah, that's exactly right, Breck. It's a lot of times I personally want to write something, but putting pen to paper is just those first couple sentences. I struggle to, think of a start or write the first few sentences and whatnot. And AI can give you a head start there. Yeah, and we're also adding to that a blog genie, which would actually even give you ideas to write blogs on, and then just based on what's trending, what people are searching for around you and whatnot. So it just give you 10 ideas, you pick one and start writing.
That is really cool. Thank you, Devang. Appreciate that. Up next, let's hear from Chris about BioLite.
Hey, Breck, thanks for having me. So I'm Chris Ray. I'm the VP of Healthcare with BioLite. What BioLite is, it is a oral IV bag that this gentleman here, Dr. Rollins, created. when his wife Janine was going through chemo treatments. So essentially, he used his 40 years of anesthesiology background to develop a recovery tool for dehydration and nausea. So it's equivalent to about 6.5 sports drinks from an electrolyte standpoint. And it's got minimal sugar, a little bit of dextrose. So if you have vulnerable populations that are concerned about blood sugar spikes, they can utilize this. And he's also added a lot of active natural ingredients for nausea, liver functioning, just really trying to, help people when they are dealing with acute illness, dealing with complex medical conditions that require hydration therapy. We're working with all the pharmacy wholesalers now, and we're stocked in about 7,000 retail pharmacies and about 20,000 retailers. And now our focal point is going out and educating the medical providers, with your dietitians, your nurse practitioners, PAs, oncologists, about how BioLite can help their patients and driving them to your pharmacies. So that's currently what we're doing. This product also has a HCPCS code associated with it. So in certain situations, it can be used for insurance. Be glad to send you guys more information on different merchandising material we have, or different social media campaigns that we can help you out with. Just please reach out, just like Breath Rocks and other items. This is a great, unique product that you can take out into your market and do some physician detailing or some athletic director at the high school detailing, or even talk to different factory workers, or people that you're wanting to do flu clinics with. It's just an excuse to go and speak to people in the community, and we love to help you guys. Appreciate it, Brett.
Yeah, thank you, Chris. Any questions for Chris? I've got one real quick one. The packets, the dry, when is that available, or is it already available?
So I received the first samples last week, and we're releasing it in early 2024. So it will be same formulation, but in a packet form.
Awesome. Any quick questions for Chris? All right. So feel free to connect with Chris in the chat. If you have any questions that you need responded to right now, or just connect with him for anything outside of the chat as well. And up next, we have my friend Cindy Gordon with Gordon Health Group. And not only do we want to bring revenue solutions to our community pharmacies, we also want to bring them cost containment solutions. And with the rise of insurance costs to cover health insurance for your employees, it's time to do something different. So Cindy.
Absolutely. Thank you, Breck. And, whether it's coverage for the pharmacists and their family, or pharmacists is looking to expand the health coverage and offer it to employees, traditional insurance is letting us down nowadays. The costs are rising like crazy. The deductibles are getting lower and lower. And as pharmacists, we all know how just for prescriptions, the insurance costs are ridiculous, and there's always ways to cut those prescription costs down through vendor coupons or just self-pay prices, PBM prices. I mean, it's just absurd what's going on. So what we love to do is partner with small business owners, community pharmacists, to basically educate them and be partners in their healthcare coverage. We want to take a lot of the responsibilities off your shoulders if you decide to move forward and offer health coverage to your employees, and take on that administration role as well. But we have a whole bunch of really unique products that work better, not just work better to keep the out-of-pocket costs down, but are so much more affordable. We're seeing between 18 to 30, 45% of savings in the premiums by going with some alternative plans like medical cost sharing plans, indemnity plans that really take care of people. I'm on a cost sharing plan. I had a medical procedure that, insurance wise, they would have been charged I want to say $140,000 for my outpatient procedure. I was able to negotiate the price because I became a participating consumer in my healthcare services. I ended up paying $1,000 out of pocket. The medical cost sharing plan prepaid all of my expenses upfront, and it was just taken care of so easily. So would love to connect with pharmacy owners, just to be a guide, educate you, and see other options that might work better for your families and for your employees.
Awesome. Thank you, Cindy. Any questions for Cindy at this time? Please connect with Cindy in the chat, and Cindy will put her contact information. I'm sure she's already done it, but you can put
I will put it in again, Breck.
Yeah. Some new people have joined. And so if your information was in before everyone joined, they'll only see what information was posted after joining. So feel free for all of our presenters to go ahead and put your information back up into the chat. And so we only have just a couple of minutes, but did want to share with you this next concept, the Fountain of Youth, or FOI therapy. This is a wellness center right inside of your community pharmacy. Now, not every community pharmacy has the space for this yet, but if you do have a consult room or an MTM room, you can turn that into a full-fledged clinic where you can provide a lot of amazing clinical solutions. It's kind of like the Minute Clinic concept or the retail clinic concept, but this is like a Minute Clinic on steroids because of the technology and new patient services that are being brought in. This a recent study from Wills says that the virtual care will be more, it'll surpass what inpatient care is. And so you need to get on board and be a part of that. And collectively, community pharmacy is a much bigger footprint for this than any one of the box store chains could possibly provide. So this is a part of the Team Up initiative, NCPA. Their big initiative for the annual conference was teaming together, bringing our community pharmacies together, and this is a cooperative program that'll do that. There is a pharmacy fund that is being put together to actually fund this for the first 10 pharmacies that have space to put this in, and the ROI is like 3 or 4 months at max in order to get that back. Here's one example in billing. One of our pharmacy clients did almost 10,000 flu shots last year. Once you're credentialed as a clinic, that reimbursement that they got, about $17 per shot, or $167,000, will actually turn into almost $1 million after they're credentialed. So it's programs just like that you'll see how quickly the revenue can be increased tenfold when you're putting in a FOI therapy clinic. And again, they'll be linked together with all of the, you'll be a part owner in that cooperative, and then that'll allow us to go out and bring programs to national employer groups that will direct patient care into your pharmacies. The other testing solutions we've already talked about, the mailbox money solutions, that's also part of this whole health hub concept. I want to show you a real quick medical device that is being put into the FOI therapy because this is the first of its kind, and I just want to do a quick demo here because this is cutting edge technology. Again, the first of its kind to receive FDA Class 2 NGX approval. And it is, I'm going to show you a leg here, a leg muscle. It's blown up, so magnified that you can see one individual little capillary on the far left-hand side here. So this is the arterial bringing the blood, to the extremities, and you'll see how lethargic that blood is moving into that capillary before stimulation. So sometimes it completely stops before it can even go in there. Only 3 minutes of stimulation, it's flowing naturally. This is using bioelectronics. And so after 6 minutes, it's like flooding into the extremities, and you'll actually see more activity on the right-hand side of the white blood cells. It doesn't produce more white blood cells, it just makes them more active, so they're doing their job. It does increase ATP, or cell energy, by 22%. So the vasomotion or circulation is improved by 30%, ATP by 22%, and it lasts up to 18 hours. This is an example, 30 minutes after treatment. So that's one of the clinical solutions. It is a new medical device that is not available to the chains. This is only being made available to our independent pharmacies. There are 10 revenue streams through FOI therapy, the vaccination clinical billing side, so 8 to 10x. It literally takes your $17 flu shot and reimburses you over $80 when you're a credentialed clinic. The My Home Health testing, virtual care, that's the actual visit with the telehealth provider. Pharmacogenomics, or PGX, blood analytics. You're actually able to predict diseases before they happen and help those patients make corrections and change their habits today so they don't turn into future disease states. The medical device has 4 different revenue streams: insurance billing, cash pay, the DME for home use for surgical recovery or injury recovery. And then about 1 out of 10 patients just end up wanting to buy the medical device, and so your clinic is able to sell that to them. And then virtual therapies that are coming down the line as well. This is going to create the largest cooperative in the country. Okay, twice as big as CVS or Walgreens will ever be. And the goal here is to be able to reach 98% of the nation in 10 minutes or less, meaning that we will have a footprint that can serve 98% of the country with a mere 10 miles or less to get to the clinic, and these are walk-in clinics. So they're, again, the first 10 who sign up will be a part of that pharmacy fund and get it completely set up for them. And this is just an example of everything that's all inclusive: the credentialing, licensing, corporation, patient management, billing and collections. Everything is done for you. And the revenue that is generated is 20 to 35K per month. That's just with 2 patients a day. The one pharmacy that is already fully functioning with this is in an area that, if they're generating 30,000 a month in the area that they're in, and you're more than welcome to ask me offline. I don't want to say it publicly here, but if they can do it, anyone can do it. And so that's what I wanted to quickly share with you. Please get in contact with me for more information. I'll get you connected with the FOI therapy folks. So that is the presentation today. Appreciate everyone being here. You know, we absolutely love community pharmacies. We'll do everything in our power to help them be successful. And that's why we put on these roundtables and invite wonderful presenters that have amazing products and services that will help you generate more revenue for your pharmacy, not just to survive. We want community pharmacy to thrive. And so that's why I'm really excited about that FOI therapy program, and do appreciate all of the fantastic vendors and partners that have been here today to present and share with you. Please reach out to us. We'd love to help. Our contact information is up in the chat. To save the chat, simply just go to the chat bubble there. And at the very bottom, you'll see the little icon there that has the emojis, the little smiley face. Right next to that is 3 dots. It says more when you hover over it. After you hover over it, you'll see a pop-up that says save the chat. Simply click on that, and everything that was put in the chat will be saved to your computer. Otherwise, just reach out to me directly, and I'm happy to get you not only the chat and the contact information, but we also recorded this, and so the recording will be available to you. If you're anything like me, no, you're a pharmacist. You're way smarter than me. I have to watch something 3 or 4 times before it really sinks in, so that's why we record this. But appreciate everyone being here today. Thank you very much. And please reach out to us. Thanks, everyone.